An obstetrical and gynecological facility that combines the best of modern medicine with the healing presence of Jesus Christ, providing affordable health care to women, in particular those with crisis pregnancies. In 2000, he formed Divine Mercy Care, a nonprofit organization performing spiritual and corporal works of mercy in Northern Virginia, Maryland, and the District of Columbia. He is currently the chairman of its board of directors. In 2005, the Tepeyac Family Center became a part of Divine Mercy Care and currently operates as the first Catholic health care facility in the Diocese of Arlington. Dr. Bukowski's affiliation with the Couple League and the Family of the Americas make him one of the foremost medical experts on natural family planning, NFP, in the country. He has spoken on various topics concerning the renaissance of Catholic medicine here in the United States, in Canada, and in Europe. He has been a part of numerous videos concerning pro-life issues, natural family planning items, and those covering the story of Our Lady of Guadalupe. Dr. Bukowski has been married to his wife, Carolyn, since 1991, and is the father of two boys, John Paul, whom I know is here with him today, born in 1992, and Joseph in 1996. They live in Oak Hill, Virginia.
Thank you so much. It is indeed an honor, a privilege, and a blessing to be with you all today. Coming up the road with my son, upon entering your lovely facility here, we were given some insights into the beautiful renovation. And as Janet talked about one of the voices, we looked at the rotunda, and we looked at that beautiful, beautiful sculpture that moves with voices. And I'm really hoping over the next 15 minutes to help pick the consciences of myself as well as the health professionals in the audience. Can I see a number of hands of who are the physicians here today? Wonderful. What about nurse practitioners and nurses? Fantastic. This is wonderful. Coming in here today, it's just so pertinent that I was behind a bus. John Paul and I were driving in, and on the back of the bus, there was an advertisement that said birth injury, birth defect with question marks, 1-800-YOST-LAW. And being an OBGYN, it's always tough sitting next to a lawyer or reading these signs. But it is interesting, though. The phrase said, birth, I understand birth injury. I'm human, and I've actually had a very tough delivery where the child's shoulder was compromised. It was a shoulder dystocia. I understand that. And I cried when she said I couldn't sue you for that. But the other phrase was birth defect. Now, how do you get sued for a birth defect? I guess it's if you allow it to come to birth. And it's what we were talking about today. Catholic Christian, Catholic citizen, Catholic clinician. And there's a crisis today in healthcare, as we well know. We live it firsthand, whether we're a patient or whether we're the provider. If you had to do it over again, would you? I can tell you that the vast majority of physicians that I speak with and other allied health professionals, the PAs that come work in our office, the nurses, the nurse practitioners, even the social workers, they're disillusioned, disgusted, and quite cynical. Just hang around a doctor's lounge to get that information. Politically, legally, economically, socially, and spiritually. In fact, driving yesterday, here I heard the other lawyer had a baby yesterday. Well, I was delivering babies, and I was running between the hospital and the office, and I heard the NPR person talk about, they were interviewing somebody who was interested in single-payer care, and she said, we have a moral duty, we have an obligation of conscience to provide access to care. And I don't doubt that. Cost, access, now reproductive health, which includes abortion and contraception, as well as ethics and conscience. The word is being bantered about today. Ethics, moral responsibility, conscience. And in our Catholic hospitals today, no money, no mission. What happens with our CEOs and our CFOs. They've got a big, big, big role to play. I know this hospital faces that. It's a big deal. It hits home. It hits all of us. So I'm talking from my heart here. And this has led to mergers, hospitals within hospitals, where you merge with a non-Catholic facility, and they can do things in that portion of your hospital that you provide electric and water to, but it's part of their institution. Giving a talk at Notre Dame recently at their bioethics, we talked about these difficult situations. And yet access seems to be the key focus of many hospital associations. And yet, in the face of that, we terminate sick children in our facilities, sterilize, contracept, and the like. And the Catholic physician today is caught in a very interesting predicament. Because why did we become physicians in the first place? Was it financial? Was it psychological? I became a doctor. I'm a history major. I come from a great Polish family. I'm the oldest of three. My dad was a school teacher. I was trained by the Salesians and the Jesuits in my high school and college days. And only 3 out of 61st cousins went to college. I became a doctor because my older brother, who was really my cousin, but he was my psychological older brother, he wanted to be a doctor. So I wanted to be a doctor. The Lord works in funny ways. Is it a job? Is it a vocation? I just want to help you, and I'm helping myself, realize that we didn't pick this profession. We were chosen. This hospital was built on that, when you walk into the front of this hospital and you read that wall and you listen to the stories, the echoes that are coming from our past, this place is not an accident. And at this time, at this moment in history, when our faith is being attacked and our profession is being attacked, we've been given a shepherd who puts on a conference of this magnitude, and this is the heart of the issue. It's all about conscience. And so today I'm going to talk a little bit about the Tepeyac Family Center and Divine Mercy Care because it comes out of my experience. Now, we talk about best practice patterns because remember, our office is built on excellent medicine, follow the teachings of the faith, but also serving the underserved. All 3 of those are integral parts of Catholic healthcare. And so we talk about excellent medicine. Are we practicing excellent medicine? As Janet talked about, is contraceptive care excellent medicine? And yet we're anticipating with interest the change we can believe in that's coming to healthcare. Stimulus money, $1.1 billion, were poured into a medical comparative effectiveness research to help determine what are the best practices. That's right, bureaucrats are going to decide what we need to be doing. Very, very biased. There was a great article in our JAMA recently, the Journal of the American Medical Association, that talked about how sometimes these algorithms, these best practices, are actually very biased. How many of us have so many challenging ways to treat high cholesterol? How many ways are there to treat ovarian cysts? And yet someone's going to tell us what best practices are. It's a perfect setup for rationing. Because once you establish the best practice for expensive operations and medical tests and aggressive therapies, you've laid the premise for funding some and denying others.